Welcome to Adapting Class Pharmacology Practice Test number 8. This is our series. Today we're talking about OB, maternity, labor and delivery medications that shows up on the NCLEX in nursing school. In this video, I'm going to break them down using 15 questions, NCLEX practice questions and answers using test-taking strategy and critical thinking. By the end of this video, you will know them, you will master them. Every question they ask you, you'll be able to answer them. I will give you mnemonics or key fact, memory tricks for each question. Let's get to it. First question, which assessment require immediate intervention? A nurse is administering what? Oxytocin to a laboring client. Which assessment require immediate intervention? I know this is prioritization question. Therefore, I'm looking for things that will change the situation of the patient, both the mother and the baby. That's what I'm care about. Contraction every 2 minutes. What do you think? Fetal heart rate of 90. Blood pressure of 120/78. Mild uterine what? Cramping. Stop the video. You can put down your answer, explain yourself, but learn from this. Stop it and then answer yourself, and then see how I'm going to approach it. I give you Pitocin. What does Pitocin do? It causes contraction of the uterus. In the process, what? Improve effacement and dilation, and then you have delivery. But what do you need to watch when I give you Pitocin? Tachysystole. The uterus can contract faster. In the process, it causes fetal bradycardia. What do you think? Do you see fetal bradycardia there? Contraction every 2 minutes is what we want you to do. Fetal heart rate 90 is bradycardia. Blood pressure is normal. Uterine cramping is expected. That's why I give you the Pitocin. I expect that. What is the right answer? Tachysystole leading to what? Fetal bradycardia. Number 2 is your right answer. So the key fact is when you're getting Pitocin, you need 5 contractions in 10 minutes. The duration of each contraction should be less than 90 seconds. And the interval after each contraction, at least 2 minutes. That's the keywords. That's the memory trick. Note that. Next time, they will ask you the same question. Which client is an appropriate candidate for Indomethacin therapy? And then it's reviewed for clients in preterm labor who need what? Indomethacin. A client at 36 weeks with mild uterine contraction. A client at 32 weeks with a history of asthma. A client at 30 weeks with closed cervix and no fetal heart concerns. A client at 28 weeks with platelet count of 60. Preterm labor, that means you contraction, you have effacement, dilation before the end of 37 weeks. Which client is appropriate? Look, whoever does not meet the criteria of Indomethacin is you eliminate it. So who is appropriate? Indomethacin is an NSAID. It's used, okay, for preterm labor, but there's specific conditions. You have to be, 32 and less weeks. Why? Because if you give it after 32 weeks, it causes premature of closure of what? Patent ductus arteriosus. Or the right word, premature closure of the ductus arteriosus, leading to what? That problem. Therefore, number 1, 36 weeks is too late. Give it before 32 weeks or at 32 weeks. 32 weeks, fine, but you have asthma. Asthma patient, you should avoid NSAID. 30 weeks, good. Your cervix is closed, good. No fetal heart concern, good. A client 28 weeks, good, with platelet count of 60,000. That is going to cause bleeding with Indomethacin. Therefore, the right answer is 3. 30 weeks and closed cervix and no fetal heart rate. So the buzzword is what? For preterm labor, when you're using Indomethacin, what you're going to do before 32 weeks, and therefore watch for what? PDA after 32 weeks. That's the buzzword. Which assessment finding require immediate intervention? A nurse is monitoring a client receiving IV Pitocin for labor induction. The same thing as number 1. I change it so that you use the content. These are the questions they will ask you. Uterine contraction every 2 minutes. Is it what we expect? And lasting 60 seconds. These are the norms you have to know. I put it in the buzzwords. Fetal heart rate of 140 beats per minute with moderate variability. Client reports what a headache and a decreased urine output and a blood pressure of 118/72 and heart rate of 84. Step back, think about it. Why do I ask you this question twice? Change the answers. I want you to figure it out. Stop the video, 10 seconds, answer it, come back and listen to what I'm going to say. What is the requirement for contraction when you're on Pitocin? Yeah, contraction every 2 minutes is enough because you need 5 contractions in 10 minutes. Therefore, you need at least 2, no more than 2 minutes, right? So that's good. And it lasts in 60 seconds, less than 90 seconds. Fetal heart rate of 140, that's good. And you have what? Moderate variability, excellent reading. A client report heart rate of headache and a decreased urine output. Think about it. A blood pressure of 118/72 and a heart rate of 84. I don't see anything wrong. Even if you don't know test-taking strategy, critical thinking, you see though, I've eliminated 1 and 2 because I use my content. And number 4, I already eliminated. Therefore, which one? I have to pick number 3. If you don't understand, this is the content, write it down. Pitocin is what? ADH. It acts like ADH and therefore it leads to water retention. If I lead to water retention, I'm going to have decreased urine output. And my sodium will go down. I will have what? Hyponatremia due to dilution. This can cause headache and I have seizures. So therefore, remember, Pitocin has ADH-like symptoms. So what is the buzz rate? Oxy make you overflow of water. Pitocin make you have what? Overflow of water that can lead to fluid retention. Therefore, number 3 is the right answer. A critical thinking question on pharmacology, NCLEX practice question, learning pharmacology, OB, maternity, and delivery. A nurse is caring for a client who is 4 hours postpartum and saturating a perineal pad every hour. I can tell you, every hour means bleeding. Rewrite the question and say, patient is post-op and is bleeding. Which provider prescription should the nurse anticipate? What do you think will help stop bleeding? That's all. Look at each medication and say, does this stop bleeding? Methylergonovine. It causes vasoconstriction. Therefore, what do you think? Methylergonovine, right? Steroid does not cause help with bleeding at all. I can tell you. Terbutaline is a beta agonist. It relaxes things. It makes the uterus relax. If you relax it, you're going to bleed more. RhoGAM is used for post-op hemorrhage in situation where there is isosensitization of the matter due to Rh negativity. Therefore, which one would you pick? Methylergonovine. No, it. Vasoconstriction causes bleeding. Certain situation, you should avoid it. And what is the mnemonic? That's it. A happy uterus contract. That's Methergine, Methylergonovine. Amabate is Carboprost. Uterine tonic is what? Like Oxytocin. And Cytotec is Misoprostol. All my happy uterus contract. They all causes contraction. So these are the medication you can use for what? Bleeding. Which action is most appropriate for the nurse? The nurse is caring for a laboring client at 8 centimeters dilated who requests pain relief. The healthcare provider prescribed IV Nalbuphine. Which action is the most appropriate? Rewrite the question. Go for the buzz rate. Make the question simple, your own way. What is that? A patient is at 8 centimeters dilated and requires pain medication. And this was prescribed what? Nalbuphine. Which one action should the nurse take? The most appropriate. Think about it. Administer the medication as prescribed. The nurse has to think about it. Hold the medication and notify the provider. Do you think she should do that? Prepare to administer naloxone to the newborn after delivery. Give the medication at the peak of contraction. Stop the video. Let me give you content. But before that, 5 questions. I know you answer 4 out of 4 because you was adapting this and clap for yourself. Give the medication at the peak of contraction. It's true. But guess what? The patient is at 8 centimeters dilated, almost about to finish the active phase. That is not good. The principle and the concept of the nursing, OB, labor, and delivery on pharmacology is what? Maternal health is what? Never Never give any opiate when there's an active phase of labor. Therefore, even 2 is good. We should, even though 4 is good, we should not do that. You want to give naloxone after delivery, it's too late. Hold in the medication and notify the healthcare provider. Best answer, hey, you want to do that? Because the patient in active phase, administer medications as prescribed. You are not basically using your whole knowledge to answer the question. As a nurse, you said no. ACE inhibitor is too advanced. I cannot give any medication. Therefore, I will hold and call you and clarify what you want. Therefore, avoid narcotic in late stage of labor, example, in active phase. Which statement indicate understanding? An next teaches a client prescribe what oral contraception. How do you take it? I will stop taking the pill if I get cold. Yes, no. I will use a backup method if I miss 2 pills. Yes, no. This pill will protect me from STI. Yes, no. I can smoke as long as I am under 35. Yes, no. What do you think? Key concept, oral contraception. Mass illness does not prevent you from taking it. If you mix 2 pills, you should make sure you have a backup. The medication does not protect you from STI. And as long as you smoke, you are in trouble, even if you are less than 35. Bad problem. Therefore, the right answer is what? I will use a backup method if I miss 2 pills. Don't stop for minor illness, no ST protection, and no tobacco. Which statement by the client indicated a need for further teaching? Select or apply. And then she's educating a client with ectopic pregnancy related to what? Methotrexate. What do you think? Methotrexate is used as what? Therapeutic management of what? Non-painful ectopic pregnancy. But there is certain condition teaching you have to provide to the patient. It's immunomodulator. What do you think? I will stop taking my prenatal vitamins while on this medication. Yes, because you have to avoid folate for the methotrexate to work. Question say need further teaching. That one does not. I will avoid alcohol onto my follow-up. Methotrexate affects the liver. If you drink, you're affecting the liver. Good point. I can take ibuprofen for abdominal cramp. You cannot. So need further teaching because ibuprofen worsen the toxicity of methotrexate. I will continue having sex intercourse as long as I feel okay. No, abstinence key at this point. I will return for follow-up blood work to check my HCG level. Yes, until it's normal before you can do anything. I can go to the gym and do my usual weight training this week. Strenuous as exercise is not recommended when you get a methotrexate because it can lead to rupture of the uterine tube. So these are the things you have to know to master the content I've given you, and you know the answer, right? You know the answer. I will stop taking my prenatal vitamin, is good. I will avoid alcohol, is good. You cannot take ibuprofen, you cannot have sex, and you cannot go to the gym. Which client condition will cause the nurse to question the prescription? Something bad in the patient history. That does not need that. And it's for a postpartum client, prescribe what? Methylergonovine. Key fact, vasoconstriction. Vasoconstriction is hypertension, what? Stroke, and MI. Do you see there? I see hypertension. Uterine atony is why we use methylergonovine. Vaginal bleeding is why we use methylergonovine. If you have been bleeding, issue of anemia is unrelated. Number 1, right answer. So it causes what? Vasoconstriction, you should avoid coronary disease, stroke, and hypertension. Key. What finding needs immediate intervention? That means something is not right. And as a client is receiving magnesium sulfate for what? Severe preeclampsia. We want to prevent seizures. But magnesium, when I give it to you, it suppresses your neurological system. So it drops things down. Your tender reflex is going to go down. Your respiratory rate is going to go down. Your urine output is going to go down, and you're going to have flushing. And most of the time, you don't see it that much. But which one should you worry about? Which one? Airway, right? Respiratory is the bad problem. Your reflex is fine, it's not going to kill you. Your urine output is you're making a progress, but your respiratory of 10 is not good. So that is the right answer. This is also required. Don't be intimidated. Don't worry. Don't run away. How many questions have you answered so far? I know you get 9 out of 9, but this question is not, it's straightforward. I'll show you the key fact. And let's prepare to give RhoGAM immunoglobulin. Which client is eligible? Who is eligible? The key concept is Rh negative mother giving birth to Rh positive, right? And then the mommy will be what? Activated if they give birth to that baby. So if you need RhoGAM, I'm going to give it to somebody who has Rh negative and Rh positive baby. And then when we do the test, we see that you're not being synthesized. So what is the problem? Indirect Holmes positivity means you've been exposed. If indirect com is negative, that means you're not being exposed. So that's a good candidate. You don't give it to Rh positive mother and Rh negative baby. That's no problem. You don't give it to Rh negative mother to Rh negative baby because there's no sensitization of the mother. So the right answer is Rh negative mother give birth to Rh positive baby. And then you have indirect contest that is negative, not positive. That distinguished it from number 3. So that's the key. So what is the problem? Rh negative mother and Rh positive baby are the key for this question. And then teaches a client about clomiphene citrate. Do you know this? This is what we use to help with ovulation if you cannot have a baby. Which side effect is most common with the next you include? Think about it. I'm stimulating you so that you have more ovaries so that they can get fertilized. The problem, ovarian hyperstimulation leading to fluid shift, change in the overall well-being of the individual. So this is very important when it comes to teaching about clomiphene. So that's very important. What should the nurse do first? A nurse care for a client taking oral contraception, client report leg pain and swelling. That should tell you DVT. If he has DVT, what do you take? Hydration, pedal pulses, healthcare provider, warm compression. Trap answers, assess for pedal pulse. This is a venous problem. There's no need for that. Apply cold compression. There's no any erythema anywhere that you worry about. You should let the doctor know about this patient. Therefore, DVT is a venous problem. What is the priority assessment? A client is prescribed Misoprostol for labor induction. Labor induction. Which one is the priority? Well, it's a medication that induces labor, right? At the same time, what it does to the baby, tachysystole, because it's tachysystole, in the process, the baby heart rate is not happy. These are some of the things you have to pay attention to. Cervical dilation, we expect that. The client is going to be anxious, right? Amniotic fluid color is unrelated. But the key is to know what the medication is going to do and you can find out. Therefore, Mispro is what? Uterine tachysystole, and you make the uterus contract faster. In a client taking terbutaline for preterm labor, which finding should the nurse report? Which one would you report? Is a beta agonist, right? No asthma problem, nothing like that. It's a beta agonist. It speeds things up. So if you have heart rate of 122, is okay. Jet drainers, blood glucose of 160, and fetal movement is present. What would you do? Which one would you report? Jet drainers is normal, as expected with terbutaline. Blood glucose of 160, do the same thing. Fetal movement is good. Heart rate of 122 is okay for terbutaline, but it's too high. It's expected, but it's too high. Once again, it's expected, it's too high. So that one, we need to intervene. And the last one, which client condition required the nurse to question the prescription? I got a question. A nurse is preparing to administer Carboprost to a postpartum client with heavy bleeding. Which condition should you make you question? Think about it. History of gestational diabetes, twin delivered vaginally, and then control asthma and Pitocin during labor. The key is this medication is good, very good for postpartum heavy bleeding. But what is the problem? It can cause what? Problem in the asthma patient. It causes problem in the asthma patient. It causes problem in asthma patient. So therefore, if you have asthma, it's contraindicated, even though it's well controlled. 15th question, English practice question, pharmacology review, maternity, OB, labor and delivery medication you will find on my channel. This is the content for you. I hope you enjoyed the series. Thank you for watching. Give yourself thumbs up for getting to this stage of your learning. God bless you. Bye.